Welcome back to We Are Austin. Exercise or playing sports is all fun and games until you get hurt. And in some cases, you may have to see a specialist to fix the problem. Dr. Michael Aronoff from Austin Radiological Association is here to share more about how that works. Thanks so much for being with us.
Thank you.
So let's hear about the work that you do specifically, what that looks like.
So I'm a musculoskeletal radiologist. So I've had general radiology training and then a specialty area in musculoskeletal radiology.
Neat.
And I do all types of imaging related to sports injuries or tumors or arthritis or bone diseases.
Oh, very cool. And how do you interact with other doctors? What does that process look like?
So they'll often they'll order studies, or they'll call me in consultation to figure out what studies to order, and then I'll interpret those studies for them, get the results, and so they can get the care that's needed for the patient.
Interesting. Okay, I know we have some examples of that today too, like what your day-to-day life looks like. So let's check out some of those photos if we can. I'm interested to learn more. So what are we looking at right here?
So as you look at this image on your on the left side, this is an image from the knee, as if I was kind of looking from your knee from the side.
Okay.
And on that left side, that's a normal look for the your ACL, your anterior cruciate ligament. So it's that black structure that's going from the top of your right screen to the bottom on the left. And the image on the right side is the ACL when it's completely torn.
My goodness. Okay, wow. And so how do you know what type of exam or scan to do to look at those types of things?
So it really depends on the body part and what the specific question is.
Okay.
So for things that are related to acute injuries, to your bones and your soft tissues, MRI is a great study. Sometimes when it's related just to a fracture, CT can be a great study if your plain radiograph doesn't answer the question for you, or the clinician needs more information related to the fracture.
Interesting. Okay, let's see some other examples as well. And I imagine, so what do we have coming up here next? What's this?
So this actually, to change gears a little bit, this is actually a different type of case that's not sports medicine.
Okay.
This is actually a benign tumor, and these are two different studies. On your left is an MRI, and on your right is a CT scan. And this is what's called an osteoid osteoma, which is a benign bone tumor. And on the left side, you'll see a lot of white, that is the bone marrow edema that's in the calcaneus.
Right.
And on the right side is the CT scan, and there's a tiny little white dot that's actually producing all of that intense bone marrow edema. Very, very painful condition, but very treatable and benign.
My goodness, how long do you have to study to be able to interpret all of these things?
So you go to medical school after you finish college. You do 4 years of training in a residency program, and then you spend another year as a fellowship training in my specific area, musculoskeletal.
Wow, so interesting. So if someone thinks they need to speak with someone like you, what's the process for finding you?
So at ARA, you can call us directly. Sometimes your clinician will put you in contact with us, but we're available for consultation to talk about what might be the best study for you. More often than not, we're talking to the clinicians about that directly and help guide them to get the proper study.
Are there any injuries that really stick out in your mind that have been really interesting that you worked on?
Well, Austin's a very, very active community, so there are a lot of sports injuries that we see every day. But there's arthritis cases can be very interesting as well. The bone tumor cases, a lot of times there are very treatable bone tumors that you can really make a real positive effect for patients. Lucky
for us, there's doctors like you out there doing the work that you are for an active city like Austin. Thank you so much. So the information is up on the screen. If you want to reach out, it's ausrad.com. You can make online appointments or you can give them a call. Thank you so much for sharing with us what you do.
Great. Thank you,
Appreciate
Taylor.
it.